Great. Welcome, everyone. We'll just wait a few moments to let folks join, but welcome. Welcome for those who are just joining. Welcome, everyone. So I'm going to get started. Welcome, everyone. Thank you for joining us for today's webinar entitled Real World Public Health Communications with Doctors Scott Rivkees and Claire Wardle. So my name is Frances Sadi, and I am the Associate Director of Non-Degree Programs here at Brown University's School of Professional Studies. So the mission of the School of Professional Studies is to empower you with the tools, skills, and networks that you need to change the way the world works for good. To serve that mission, we offer a portfolio of programs including master's degrees, certificate programs, short courses, and free masterclasses such as this one. So today, you'll hear from one of the nation's top experts on the complex ways that misinformation spreads and on how public health leaders can learn to adapt in order to connect with the public more effectively. We'll also spend some time engaging with the audience, so please do send us your questions throughout the talk using the Q&A feature found at the bottom of your screen. And then after the Q&A, we're going to present to you some ideas we have for an upcoming public health conference that we're hoping to hold, and we'll ask for your feedback on your interest and your preference on delivery for that. And so now it's my pleasure to introduce you, the man behind the event, Dr. Scott Rivkees. Dr. Rivkees is a professor and interim chair of the Department of Health Services, Policy and Practice here at Brown University's School of Public Health. He served at as Florida's State Surgeon General and Secretary of Health during the COVID-19 pandemic from 2019 to 2021. Named one of America's best doctors, as well as one of America's top pediatricians, Dr. Rivkees is a pediatric oncologist and a physician scientist. He's had more than 35 years of continuous research funding from the National Institutes of Health and has more than 250 publications. Scott has held positions at Harvard, Yale, and Brown Universities, as well as Massachusetts General Hospital. And while living in Florida, he served as the chair of the Department of Pediatrics at the University of Florida College of Medicine for more than 7 years. Here at Brown University, Dr. Rivkees focuses on pandemic preparedness, health officer leadership training, and directs the Accelerated Masters of Public Health program. He was also recently appointed the new academic director of the Masters in Healthcare Leadership program at Brown School of Professional Studies. Scott, it's such an honor to have you here with us today, and thank you for making time to speak to us on such an important topic.
Yeah, thanks, Fran. All of you who are joining us today, listen, thank you so much. As Fran mentioned, Scott Rivkees speaking to you from beautiful, sunny Providence, Rhode Island today. So it's a glorious day here. So why are we having this conversation today? As you know, we're in really dynamic times when it comes to public health. We've come out of a very significant pandemic. And this has also brought certain challenges, and with this come the pandemic of COVID. Also become the challenges of communication, challenges of misinformation. And one of the things that we do at the School of Public Health is, focus on what are the issues that we need to focus on, so all of us can do our roles in a stronger capacity as things are changing all around us. So today, really delighted to have Claire Wardle join us and share her incredible wisdom with us. So, Claire and I have worked together very closely over the past 2 years, and we're really glad that you joined the School of Public Health. That you certainly have made the environment richer here. So, Claire is the co-founder and co-director of the Information Futures Laboratory and is professor of practice at Brown, like myself. Now, Claire is a leader in the field of miscommunication not just the United States, internationally. She is a co-author of the foundational report, Information Disorder, an Interdisciplinary Framework for Research and Policy for the Council of Europe. In 2015, Claire co-founded the nonprofit group First Draft, a pioneer, and she's been a pioneer in innovation, research, and practice in the field of misinformation. Over the past decade, she has developed organizational-wide training for the BBC, different forms of media as well. Claire has been a fellow of the Shorenstein Center for Media, Politics and Public Policy at Harvard Kennedy School, and has been the research design director for the Tao Center for Digital Journalism at Columbia University. And Claire obtained her PhD in communications at the University of Pennsylvania. So Claire, thank you so much for joining us today. As we talked about, certainly communication is such an important tool when it comes to public health and healthcare, and we all have new special, challenges that we're dealing with. Some that are relatively new. So really appreciate you, helping us provide insights in terms of what's happening now, and most importantly, how do we prepare ourselves for this important challenge? Thanks for joining us, Claire.
Thanks so much, Scott, and welcome to everybody. Hopefully you're on your lunch break, although that seems quite quaint, those of us who have lunch breaks. But I'm going to talk quite quickly. We've got about 35 minutes, and I'm going to try and keep this snappy. My plan is to give you a number of examples and types of things that might spark some conversation afterwards. So let's get going. In terms of this session, I'm going to start with really thinking about our contemporary information ecosystems. What does it look like to communicate today in an age of fragmentation, polarization, declining trust, information disorder? We've now got generative AI that we need to struggle with. I'm then going to talk a little bit about, I think we need to flip the way that we think about this problem, as opposed to just focusing on the bad stuff. I actually think there's a lot we can do as universities, public health departments, journalists to actually answer community information needs as a way of building resilience against misinformation. And I'm going to end with some kind of practical steps. So let's start with where our contemporary information ecosystem is. It is fragmented. We are no longer at a point where there are 3 channels and people sit down at 6 p.m. It is fragmented, it is divided. People spend time in spaces where they absolutely do not bump into other people. I'm British, the BBC is not perfect, but 78% of British people bump into the BBC every day. That is not the situation in the US, and we have significant splintering and challenges in terms of how do we reach people when they're spending time in very different places. And of course, this quite complicated chart talks about that. But here's a ton of logos involving the different kind of social networks that people are spending time on, hours and hours at a time. Some of my students can spend on average of 6.5 hours a day on TikTok. The highest number I've ever heard is 14.5 hours in one day. But streaming platforms like Twitch, closed messaging spaces like Telegram, server spaces like Discord, it's confusing out there. And we've also got a splintering. So we've now got a growth of platforms like Getter, Gab, Rumbler, BitChute, which are seen to be, almost no content moderation, a place for freedom of expression. Well, what does it mean when we've now got a splintering of social networks as well? And unfortunately, all of this is playing onto the situation where we are more polarized than ever. This is research from Pew from a couple of years ago. The kind of intolerance that both the right and left has for each other is deeply concerning as people spend more time in their own spaces. And on the right-hand side, we have a word cloud, essentially people describing kind of US politics today. Like, there's no denying we are in a troubling place, and we know this. Health issues have been politicized and weaponized. We now see a kind of a distrust ecosystem, as one academic talks about. The people who deny climate, deny trusted elections, deny COVID, all of this is coalescing in really troubling ways. So what does that mean? This is from the Edelman Trust Barometer. What we're seeing is as trust declines in our societal leaders with this perception, people believe that they're being lied to. Where are people turning for information? Well, actually, when you ask who do you trust, it's becoming more local. People's trust in their co-workers and their neighbors are where trust is increasing. So whilst, yes, there is a disturbing decline in trust in institutions, we have to recognize why that is, and we have to look inwards at some of the missteps that were taken by many trusted institutions during the pandemic. But we also have to see a real opportunity here for, okay, when people are turning to one another, how do we work with community leaders to co-create messaging? How do we build resilience in communities who are increasingly becoming the places that people turn to make decisions about vaccines or their diet or their medications and other things? We either go, oh, this is terrible, or we say, that's the reality. How do we work with communities so they themselves can become those trusted messengers? So that's the kind of information ecosystem challenge. And let's think for a second, you're head of comms for the Rhode Island Department of Health. Things look very different in 2024 than they did in 1996. We have a very different set of information ecosystems. I obviously talk about that as a plural. There is no one way to communicate. We have multiple audiences, multiple communities. But another challenge we have, of course, is the rise of information disorder, which is the phrase that I coined back in 2017, where I tried to help people understand the differences between disinformation, knowingly false information shared deliberately to cause harm. We actually have a relatively small amount of disinformation actors. The bigger problem is my mum, or people who mistakenly share that false information, not realizing it's false and not meaning any harm. And the ways that we might take action around disinformation actors, of course, needs to be very different to misinformation actors. And malinformation is a term I coined to say, sometimes we have genuine information which is shared to cause harm. That might be the leaking of emails. It might be intimate images that are shared. It might just be, doxing of somebody, or increasingly we see genuine imagery shared, but it reinforces people's existing worldviews. So it's designed to widen those divisions that exist in society. And I came up with these 7 types about 5 or 6 years ago to try and say, listen, the term fake news is not helpful. A lot of this content isn't fake. It's actually genuine, but used out of context. A lot of it doesn't look like news. Things like labeling something as satire deliberately to get around fact checkers, imposter content. And so some of those examples include, this is our biggest type that we see online: false context, genuine imagery, but used with the wrong caption or the wrong date or out of context. So here's nice weather has brought people out to the march to end COVID-19 in Cleveland. I didn't have to generate this. This is an actual image. It was actually from the Cavaliers Championship parade, right? Takes nothing, costs nothing, can be exceptionally influential. Manipulated content. This was actually an image taken in February of 2020. It took somebody 2 seconds to add the mask with Photoshop. It does what it needs to do, right? It's xenophobic, it's anti-Asian, and it's driving falsehoods around people's beliefs around the pandemic. Imposter content. We know that when our brains are overwhelmed, which increasingly we are as we're scrolling, our brain relies on what's called heuristics, mental shortcuts. So the use of logos or names of people or institutions that we do trust is a very quick fire way of making people go, oh, I don't need to check because I trust the WHO. So we see a lot of this kind of imposter content. And of course, fabricated content, which for a while, I would use this term to describe completely made up rumors. Now I use this term to describe AI generated content. This actually came from Ron DeSantis's War Room, generating an image of Donald Trump kissing Fauci. This costs more money than a cheap fake. But these kind of generative AI images, of course, we're seeing more and more of them today. So there's all these different types of disordered information that we now also need to struggle with. And for anybody who's got teenagers or even 8-year-olds in the room, they know that mimetic culture really is the bedrock of the internet. It's a kind of a nod and a wink to internet culture. And so we see a lot of disinformation is very visual and it's kind of this jokey content, but can create real harm. And the challenge for institutions is, should we be creating memes? What does it mean to be involved in this kind of content? So I just mentioned generative AI. I don't know how many of you have seen the new tool from OpenAI. This one's called Sora. It was launched about 2 weeks ago. You can put in a prompt, just a 1-sentence prompt, and it will produce extraordinarily good video content in seconds, right? So this is a very impressive version that was launched on the first day. This is a less impressive version, which just goes to show that it's not perfect yet. So the prompt here is glass of red liquid smashes. but people had forgotten to tell the AI about physics, that the glass also has to smash, right? So we're at a point where we need to be concerned about AI. It is not perfect, but it is getting much, much smarter every single day. And so thinking about both the ways that this can be used by bad actors, but also the opportunities this provides us in terms of health communication is something that we need to think about. We have things like symptom checkers, like buoy, or boy, as we say in my country. But there was some very interesting research by a colleague here at the School of Public Health who looked at different symptom checkers. And about half of the symptom checkers, if you put in classic heart attack symptoms, about half of them said, quick, go to ER. Half of them said, sit down and have a cup of tea. So we have no regulation around these kind of AI products, and trying to think about how do we keep on top of these innovations, but also build the guardrails. We're in this kind of arms race right now that we have to keep on top of. For those of you who use Chat GPT, I think this is a kind of a humorous image about the speed at which it's improving. We're about to see the launch of Chat GPT 5. This has only happened in the last year and 4 months, this evolution. And there's no doubt that the quality of the output is improving significantly. But this is Chat GPT 3.5. If I say, what is the latest scientific evidence about the impact of multiple COVID-19 infections? It does start by saying, as of my last update in January 2022. So it is already saying I'm kind of out of date. So again, it definitely has limitations if we're trying to keep on top of the latest scientific information. But here's something I use it for quite a lot. So I am not as smart as Dr. Rivkees. I am not a trained doctor, but sometimes I want to go to the New England Journal of Medicine. And so here's a classic journal article. I put that into chat and I say, can you simplify this? So it comes back with a simplified version of that article. And I say, it's not simple enough. I told you, I'm not as clever as Scott. And I say, could you simplify it further? And it gives me an even more simplified version. And then I say, can you simplify it for a 10-year-old to understand? And it gives me this. So there's all sorts of interesting ways we need to think about AI for health literacy and for communication, and to understand what it does have the possibilities, particularly around translation, reaching people using empathetic language. So what's interesting is we have a lot of AI systems that when tested on patients, they say, oh, the AI has more empathy than my doctor. So there's so many interesting communication elements when we think about AI. So that's where we're sitting, right? There's a lot of exciting developments. There's a lot of really worrying developments, and we have to sit in the middle of that ambiguity of understanding where this might lead us. But I want to talk a little bit more concretely now about, from my own work, I've been thinking about misinformation for 20 years. And I'll be honest, for the first 18 years, I was chasing the bad stuff. I would find examples of bad stuff. I would fact check it. I would debunk it. I would try and tell the platforms to think about labeling that kind of content. And then through the pandemic, I just realized, what am I doing? Like, we are always going to have these areas of the internet full of problematic content, right? That's an aspect of human nature. And actually what I recognized was to really think about the people who deeply believe the worst of the worst, right? So I think about this like an iceberg. We tend to fixate on the top of the iceberg. We tend to fixate on the worst of the worst, the people who believe unbelievable QAnon conspiracies, or the idea that Bill Gates is microchipping us. Like, that's what drives headlines. That's what drives funding. That's what drives conferences. I get asked to talk all about these kind of issues. But actually, that is the smallest part of the internet, right? I think we've got much bigger parts of our information ecosystems, which is people with really valid questions and concerns. And if we deeply listen to those questions and concerns, we realize that those people are not having those questions answered quickly, in formats that they can understand, in spaces that they're spending time. We're doing a really bad job. And when I say we, I mean universities, I mean newsrooms, I mean health spokespeople. We are failing to meet people's information needs. And when there's a vacuum, that's when conspiracy theorists take advantage. So when you start listening, and we scraped in Rhode Island, when I say scraped, we basically pulled down the questions that people were asking Google. We looked at Reddit. We looked at places where people were asking questions. And we realized that people this was just around mental health in Rhode Island, really good questions. But then when we were like, well, surely the answers are there, it was kind of shocking when you then look at the supply and demand often there is not good information to answer these questions, definitely not in different languages, that's culturally relevant, that's being posted in the places that people are asking those same questions. So increasingly, my work has been flipped on its head. So rather than just trying to hunt down the bad stuff, it's how can we more effectively answer people's questions and concerns? Because I just pulled out these on Twitter as I was pulling this together. People have still got questions that they can't find good answers to. And I think in many ways, we have not done it. If I went and walked down the street and asked people on the street, how do vaccines work? Most people still can't answer that question. They don't know the science of immunology. Well, that's a problem because if we're trying to talk about mRNA, but we haven't we're not, building upon a foundation around what is a vaccine, we've got a problem. So really, again, listening to those questions is so critical. And this is an interesting example again from Rhode Island. There's a newish website called Uprise RI, and they've built their own AI chatbot that you can actually ask questions of the chatbot around housing issues or problems with a business. This is just a pilot, but we're going to see more of these kind of chatbots, I think, as a way to answer people's questions. But we need to make sure that we've got guidelines around that. I mean, this is an interesting example. There's no transparency about how they built this chatbot, which sources they relied on. So we need good handbooks and guidelines for kind of government agencies building chatbots. So there's a lot here, I think, that's really interesting about community information needs. But at the same time, we've got to do it effectively, and we've got to do it with communities. We've got to co-create these technologies. So let's talk a little bit about the practicalities of responding to the kind of information environments that I'm talking about. And some of you might work for organizations where you are thinking, well, where do I start? Well, one thing you can do is to set up social media monitoring. And it's not perfect, and I'll get to some of that, but it's really important that you are aware of the kind of questions people are asking. So looking on Google Trends to see, well, what kind of questions, if there's a new vaccine that comes out, what are some of the other questions people are asking about those vaccines? There's a free tool called CrowdTangle, which is not as good as it used to be. It's owned by Meta, but it allows you to set up streams of information from different social media sites. And it's a good way to try and get a sense of what's happening. There are paid for tools like Meltwater is an example of that, which tends to, it's a paid for tool. It is much more powerful. It allows you to understand things like share of voice, sentiment, which we've always got to be a little bit careful about, but again, can be a useful exercise. One thing I'd say though, is we shouldn't just be using social media to find rumors. We should be using social media listening to really deeply understand community questions and concerns. So it's not just the bad stuff. What are people confused about? Because we also have to recognize that one of the challenges here is that a lot of these kind of conversations are not really happening in public spaces anymore. There was a time and place where people would share everything on Facebook. And as a researcher, I could go onto Facebook and read all sorts of private things. Luckily, people have kind of figured out that's not the most sensible thing to do. So we know a lot of these conversations are moving into WhatsApp groups, Facebook Messenger, Telegram, email, those kind of spaces that families communicate, or friends, text groups. And so whilst social media monitoring is important, we also have to remember it doesn't get us all the way, right? Which is why we also need to listen with communities. We need to partner with communities to set up things like tip lines, to send out weekly surveys to understand what people are concerned about. And I also want to stress this about social media listening, which is the 99-1 rule, which is any of you that spend time on the internet, you know that normally one person starts a post, let's just say 9 people respond. There are normally 90 plus people who you never see because they're lurking. And so sometimes we can focus too much on the loudest voices, which is why we also have to work with communities themselves, because this is an example from I'm in a Rhode Island mummies group, because mummies groups are the best place to find misinformation. There's actually good research on this, that somebody at George W. University did some research and found that almost all rumors started in mummies groups. But anyway, there's a longer conversation about that. But here's somebody who said, any mamas out there who decided to not give their toddlers vaccines anymore, debating on whether or not I should continue my 2-year-old shot on his next visit. And I was like, oh dear, you're going to get absolutely crucified. Oh, I was wrong, because all of the 15 comments were like, yeah, you're right. I stopped vaccinating my kids 2 years ago. Yeah, I stopped. Best decision I ever made. I was like, what is this? But going back to that 99-1 rule, this is about social norms being created. There are lots of mummies here who are like, I don't want to be the person who says I'm vaccinating. So the challenge when we think about social media as a source is it doesn't always reflect what's happening. It reflects the loudest voices, but it does help us understand how social norms are being shaped. The other thing I want to point out is it's very easy to focus on individual examples, but we really need to think about narratives. So too often we're like, should this post be labeled? Is this post disinformation or misinformation? When actually, what's the wider narrative that's happening around this? So understanding the way, for example, globally, there is an ongoing narrative that has been around for a long time about the West uses vaccines to sterilize low and middle income countries. That is an existing narrative. So anytime we see an example of that, it fits into that broader narrative. So I often say to organizations, do a narrative mapping exercise to understand which narratives are out there. And in the summer of 2020, the nonprofit that I led at the time, we did a big project involving 20,000 posts from Facebook, Twitter, and Instagram in English, Spanish, and French to understand the major narratives as the world was gearing up to the launch of the vaccine in November. And what we found was 6 overriding narratives. So in those 20,000 posts, these were the ones that were circulating. And the number one narrative in the English language, for the Americans in the room, maybe not surprising, was liberty and freedom. It was not, is this vaccine safe? Is it necessary? It was about who's going to tell me that I have to get vaccinated. And when I did some training for the CDC, they were like, this is really interesting, but from our remit, we couldn't comment on any of these narratives other than safety and efficacy. So we have to understand if narratives are circulating in certain ways, how are we responding to those narratives? And that is a real communications challenge. And we need to be aware that sometimes the narratives circulating around a topic are not the ways that we're thinking about a particular topic or issue. And finally, a specific response strategy that I think many organizations need to have. This comes from the debunking handbook, but it's very much if you see a piece of misinformation, what should you do about it? And so there's some really interesting science now around pre-bunking, which is actually if you get ahead of something. So as we come into this lead up to the election, a pre-bunk would be, it is likely you're going to see an image of a ballot box in the wrong place. That doesn't mean that if you see it, you should ignore it, but just be a little bit more aware when you see it, because that is a known rumor that we see every election globally. So that pre-bunking is essentially letting people know that they might expect to see that. Or what we call inoculation in the communication sciences is the idea that you teach people tactics and techniques. And the science shows that actually people are better at spotting misinformation in the wild when you've taught them those tactics and techniques. If you debunk the content, people are like to be like, what do you know? You're telling me I'm wrong. I don't think so. Like all the issues we know about confirmation bias and how we're really bad at changing our minds. Well, if you focus on the tactics and techniques, you're not challenging the person's belief systems. You're like, I just don't want you to be manipulated. So in this flow chart, it's like, okay, if the misinformation is expected, you should pre-bunk. If it's already out there, how visible is it? If it's not circulating very widely, you might not want to issue a debunk because you're going to give it more oxygen. And then when you do debunk it, how can you do it? And there's a concept of the truth sandwich that you start with the fact, you then include the myth if you have to, but give it a warning, and then you end with the fact. So there's a whole science about effectively debunking this. But for many organizations, they debunk too quickly and they end up giving more oxygen to a rumor that they didn't necessarily have to. So all of this might be ensuring that on your team, you have somebody that's had specific disinformation training, that you've done some red teaming exercises about what did we do if our organization gets pulled into something, how should we respond? All of these things are about being prepared and being prepared before the thing hits on Twitter and hits big time. And the last thing I'll just talk about is effective communication. So no offense to my friends at the Australian Government Department of Health, but this came out before the pandemic, and it's something like a 60-page PDF. There is hardly an image. There might be a diagram. It is very text heavy. It's a PDF. This is what universities love. It's what scientists love. We love text. But unfortunately, we're up against people who communicate much more visually, much more simply, and with a real understanding of emotion. And so I'm not saying that the Australian Government Department of Health should create memes of dolls with vaccines, but we have to recognize that there are different ways that our different information ecosystems are working, and we cannot keep thinking that pumping out PDFs is the answer. We have to understand there are different ways of communicating. And so I often use this slide to describe, when I say our information ecosystems, but universities, top down, linear, traditional ideas about expertise, like this, a webinar with one person who talks. That's how we like to think about communication. We broadcast. It tends to be based on the deficit model, this idea that people need more facts, very few, if any, feedback loops. We might have time for 2 questions. It tends to be text-based. It's distance. It's about objectivity. But the other information ecosystems, the ones that I spend a lot of time in, the kind of anti-vax spaces and others, those spaces are participatory, they're dynamic. Expertise comes from experience. If you're a mother with a baby, you're on TikTok talking about the RSV vaccine, you're the expert today, not Scott, because you've got lived experience. And that understanding of how people take lived experience as expertise has completely changed how people are making decisions over the last 2 decades. But in those spaces, anti-vax spaces, people feel like they're heard, they have agency, they're told to do their own research, they share that research, people like them and comment and say thank you. There's lots and lots of two-way information flows. There's lots of stories. It's heavily visual and emotional. We have to understand those differences and think about how we in our institutions can think about how we change and upgrade our communication systems, because too many of us still communicate like it's 1996 and rely on press releases. And that is not the way that we should be communicating in 2024. So just a couple of other things. We should not be mocking conspiracy theorists. We have to have empathy. This was a study that suggests that more tweaks that mocked 5G conspiracy theories inadvertently popularized it. This is an infamous tweet from the FDA that actually ended up in a lawsuit, which was an attempt to kind of use humor. You're not a horse, you're not a cow, seriously, you'll stop it. Well, this actually was seen as condescending. Whenever I do focus groups with anti-vaxxers, they still quote this. And there's this real belief that, well, ivermectin is used safely globally for a whole host of other issues on humans. So why are you saying this? So we've got to be so careful about how we think about tone and humor and memes. And this is an example. Nicki Minaj, you may remember, was not invited to the Met Ball because she hadn't been vaccinated. And a snarky journalist replied, because she said, I'm only going to get vaccinated when I've done my own research. And Kevin Cruz replied, do your own research? Do you have a team of scientists running clinical trials out of a spare bedroom? Funny, snarky, all the rest. This is Kizzy Corbett, as some of you might know, who was part of the Moderna team of creating the Moderna vaccine. Her answer is perfect here. She says, first off, I empathize with this sentiment. I want every single person to get vaccinated out of their own informed will. This is exactly the way we need to be talking to people. So using empathy, listening, making people feel like they have agency, that's what we need to be doing more of. And this is a really good community toolkit created by the Surgeon General, which gives lots of ideas about specifically talking to people who have different positions on different issues and believing in misinformation. Again, we'll send out some of these links afterwards, but it's a really useful toolkit for working with communities. So just to kind of sum up some of these key points. Number one, really listen, not lip service, not tell us what you think, but then never read the comments. Really listen and be responsive to people's questions, concerns, and confusion. Secondly, acknowledge those questions and concerns so people know that you are hearing them. Communicate the I don't knows. I mean, we could have a whole webinar about the failings of institutions to recognize the I don't knows at the beginning of the pandemic. Use more visuals, use more stories. Don't be frightened of leaning into emotions and first-person experiences. Respond in places where communities are spending time. We can't keep being over here on Twitter when actually everybody else is spending time on Facebook and Instagram and TikTok. And where possible, find, partner, and co-create with trusted messengers. And trusted messengers, this isn't about Taylor Swift. Trusted messengers are people in the community. It might be the person who coaches a softball league. It might be a faith leader. It might be the person who cuts people's hair. We've got to think about those people in the community who are trusted and really can play an incredibly important role in disseminating and co-creating messaging with those who need it. So I think I've hit my time slot. So I'm very happy to take any questions or just have a longer chat with Scott.
Yes, thanks so much, Claire. That's terrific. I always learn so much when I listen to you. I know we have some questions from the participants. Also, participants, if you have additional questions, put them in the Q&A feature, and I'll read your questions. So, this is so complex, and the complexity continues to evolve. So, a couple of questions in terms of thoughts about, are we ever going to be able to moderate content in the face of so many different platforms that are out there? That's the first one. And second, I was intrigued by you talking about how do you monitor this? You talked about crowd tangle, meltwater. Our organization, can you give examples of some how organizations are actually using these monitoring tools? Because, thinking of being in a Department of Health before, in terms of guiding and directing our communications team, it's really difficult keeping up with all of this.
100%. So to start with this question about content moderation, I mean, absolutely right in terms of how do we do this in multiple languages on multiple platforms, but also in the face of unsettled science. Because actually, during the pandemic, some content was labeled misinformation, which then we realized wasn't misinformation because the science evolved. So the challenge with content moderation is, and we know that many people actually see content moderation as censorship. We see debates right now about, we see this with Elon Musk on Twitter, now known as X. There are real challenges with doing content moderation. And so I think that goes back to the community information needs, which is, I think, rather than waiting for bad stuff and then slapping a label on it, we're actually better off kind of working earlier up the information supply chain and ensuring that people have good information when they need it. So if they see the misinformation, they're like, oh, that's not what I heard. So I would argue that I think there's a real challenge, particularly with the First Amendment and other spaces, like content moderation, unless it's absolutely clear. If somebody's saying drink bleach, if they're saying something that is obviously going to cause harm, then that kind of content should be moderated. But I think there's other types of content that I think maybe we moved quite aggressively around the pandemic, and it's caused this moment of like, we shouldn't be moderating anything, which I also don't think is correct. To your point about social media listening, I mean, it's a real skill. I mean, I think there are many organizations that don't necessarily recognize which tools exist and how they should be used, because of course, social media listening is only as good as the keywords we put in. So let's just talk about vaccines for a second. Many anti-vaxxers talk about it as health freedom. So if you're not searching for the term health freedom, you're not going to see that kind of content. Or during the days of vaccines, when the Johnson & Johnson vaccine was being rolled out, in certain Black communities, and my team told me this, it was like, it's called the hood vaccine. And I was like, oh, I didn't, so understanding slang, understanding different ways that things are described, you need to have that. But I would argue that for almost any major health department, they should be doing social media listening, and they should have actual analysts, at least one member of the team who's doing that. But they should be also thinking about offline ways of listening. So as well as those like monitoring Facebook comments and other things, like having things like tip lines or having town halls or having other places to hear from people, because not everybody is online. And often, as I said, the people online posting aren't always the people we want to hear from. So I mean, the CDC has a really good integrated model of doing these kind of insights reports, and it's a mixture of online and offline. And I think there is measures to try and educate lots of departments of health on these kind of tactics and techniques.
Thank you. I'm going to read a couple of questions that we have. Uh, One question is, in a previous talk, it was mentioned that doctors still have more trust than other resources, but maybe because of supply, access to doctors is a fairly immediate resource for questions, and it's very difficult to get. Instead of replacing this person they trust, how do we restructure the business to increase access or increase supply of the trusted source?
Yeah, I mean, it's such a great question because it's absolutely right that if you're somebody who has had a primary care provider and you've had them for a number of years and you have really had a positive experience, you will trust almost anything they say. But when we do research with people who can't get access, I moved to Rhode Island a year ago, it took me 7 months to find a primary care provider. There are many Americans who just either can't access or don't even know where to start and don't have insurance, et cetera, et cetera. So I think, to be totally honest, in the health communication space for a number of years, we're like, yeah, but doctors are trusted. And we didn't think about those people who didn't have one or have had a bad experience with their doctor, right? You only need to have one bad experience and then that's it. So I think we have to recognize that it is a supply and demand issue. And we also have to recognize that that relationship is so important. How do we train new doctors in really, and we know this, nobody's got any time, but empathetic listening. Like, how do we really train doctors to make people feel heard? How do we make doctors really listen to maybe communities who haven't always been felt like they've been heard around their descriptions of their pain? So it's a real opportunity, but as you say, right now we've got real challenges around access, and I would love to see more made of that, because if we can improve people's relationship with the healthcare system, we will improve trust in those people who are communicating from the healthcare system. And at the moment, we're in real problems.
Thank you. Another interesting question. If you know about this, what do you think about the Johns Hopkins School of Public Health Instagram meme format? Do you think anybody in public health is doing health communications particularly well?
I love that you mentioned John Hopkins, and I could be wrong, but I think something like they have like 20 people in their communications department. I mean, what I love about that is that John Hopkins has said communication is critical to public health, and we're going to resource it properly, and we're going to test different formats, and we're going to use fun and humor and visuals, and we're going to train our students in it. I mean, I came to the School of Public Health at Brown 2 years ago because the dean, Ajit Shah, said, we haven't taken information and communication seriously, and we have to make sure that our next generation of public health leaders understand that. And so I think I love what John Hopkins are doing, and what I love is that they're constantly iterating, they're evaluating, and they try on different formats. They've got a great TikTok. I mean, they just are, I think, doing some of the best work here. But also, I just want to acknowledge they have a large team doing it. So I think this idea, well, can't Bob just do social media, which is too often what I hear in institutions, this idea that just, oh, we just need one, or can't the intern do social media? We have to recognize that this needs to be a properly resourced team and with people who have got specific training in this work.
Yeah, and also coming from the public health sector, many departments of health don't have the resources to be able to have a team that large, even large
Nope.
departments of health. Another question. I love your approach and posture towards dealing with bad content and how you make a deliberate choice not to spend your energy on responding to misinformation, but rather focusing on the spread of true and helpful information. Can you say more about how to best to unify and disseminate public health messaging?
So I'm going to talk a little bit about a project that we ran in South Florida just before the holidays. And as part of that project, we identified what we called 25 information navigators. And they were from Spanish-speaking diaspora communities. One person was a teacher, another person was a librarian, one person owned a hair salon, somebody else was a lifeguard. They were all from all walks of life. And every week we would ask them, what is your community concerned about this week? What questions do they have? And then we would send back content that was designed for WhatsApp. It didn't have the Brown University logo on. It was information that we then gave to those information navigators so that they could then talk with their communities with it or post it themselves on their Facebook groups. And that to me was such an interesting example. And the feedback was so positive because it wasn't a top-down approach from Brown University. We were co-creating content with these information navigators who were like, oh, well, you just gave us a link to the UN, but the UN is not trusted in our community, so we can't use that link. How about this link? Or, actually, can we do this as a voice memo? Because many people in my community like to listen. They don't necessarily like to read. So it was all of these learnings about what does it look like when you partner with people in communities and really provide quality information, but in a format that makes sense and resonates to different communities. So we learned so much from that project, and I would love to see that kind of a model really expanded, because I think that the model of working with communities is the only way forward. Funders go, oh, it's too expensive, but it's the only way through this is partnering with communities.
Right, thank you. And then another question. With the emergence of AI tools, how do we determine which content is false, imposter content, as you call it?
Yeah, I mean, this is tricky. I used to run workshops all the time for journalists and community members about how would you verify something. And so simple things like a Google reverse image search. If you see an image, put it through Google reverse image search and it will tell you whether that image has been around previously. So, well, actually, that's from the Cavaliers parade from 2016. So I know that it's not true. Unfortunately, with AI, we don't have those tools yet. We don't have ways to do that. So it's things like, do the fingers look spindly? Are there shadows going in the wrong way? Does the necklace fit? I mean, unfortunately, we're at that level. So I say to people, just be really careful about what you're sharing. And just, whenever you see something, go to Google and say, and describe what's in the image. And then mostly you're going to see a news organization say, no, that's already been debunked. Like, do you remember the Pope in the puffer jacket? If you put that into Google, you'd immediately see a fact check about it. So we have to be more skeptical, but we can't. I mean, the other worrying trend is people saying, well, I don't trust anything these days. You can't trust anything you see with your own eyes. Well, that is also a real concern. So we have to keep trusting, but we just have to be very, very skeptical. And we have to read sideways. When you see something, go somewhere else to check before you forward it.
Okay, great. I'm going to ask another question which came in. Then I want to go to a poll. This poll is going to be really important for us if you folks can stick around in terms of future events. Hello, Claire. As an aspiring public health communicator, currently pursuing an MPH degree, your expertise has been invaluable. In light of the challenges associated with responding to pre-existing narratives, you articulated a strategy focused on imparting tactics and techniques to counteract susceptibility to misinformation. Considering this approach, could you elaborate on what you perceive as the most efficacious awareness and engagement strategy for proactively crafting accurate narratives prior to propagation of misinformation within the public domain?
Great question. So I think there's two things here I'd say is that I would love us to just do more education work, right? So more workshops and other things, maybe just a series of Instagram posts where we teach people the tactics of the techniques. Like we teach our nanas not to get scammed, right? We teach her how not to get scammed through the mailbox. It's the same thing, right? We need to teach people how, wow, if you see a logo that you trust, it might be. So we need to do more of that. And we need to do more of that in the age of AI, to the point of, if I'm a Department of Health and I'm trying to roll out some new initiative, that what I was talking about there about mapping the narratives, we need to be aware of the ways in which a certain new initiative might land, right? So we know, unfortunately, right now in Florida with the measles outbreak, that is being seen in the context of the narratives around freedom and lockdown. So it's not happening in isolation. It's happening in reaction to people's responses to COVID measures. So that's one thing I would say to departments of health or other agencies. You can't just see your rollout in a vacuum. You've got to understand how this has been met previously. And sometimes that means naming it. Like, this is what we learned previously. However, blah, 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 blah. And we have to really understand that people make sense of the world through their lived experiences and histories. We cannot right now pretend that that doesn't exist. So I think understanding different communities, particularly communities of color and their lived experiences and histories, is critical to understanding the way that narratives circulate, and being aware of our recent history when it comes to what happened during COVID. That is shaping everything that's now being rolled out. So I think it's a very quick answer to a complex question, but I think it's about being aware. We can't start something today that's not built upon everything that's happened before.
Yeah, thank you so much. Leading off of the initial part of your response, you talked about education. This leads us to a poll, which will give us an idea about whether we should continue these types of seminars or even, a grand response. Fran, can you bring up the poll? And if everybody can stay on for a minute or two to answer this, this will be really, really useful for us. So, a first question that we actually have is that if we were to offer a conference on real world public health that involves a focus on communications, operations, policy, workforce, and other topics, what format would you prefer? Single choice, virtual, in person only. Second question is, how long do you think a conference like this should last? Part of a day, a full day, 1.5 days, 2 to 3 days? Thank you for beginning to answer. Third question is, would you prefer a conference that takes place on a weekend or midweek? Weekend, midweek, you don't have a preference. And in terms of times that work best for you to attend, in terms of times of the year, January through March, April through June, and or July through August. So, thank you for, you know, um, giving us your comments, because this ends up being really important in terms of guiding further events. And we'll wait a little bit for individuals to put in the response. While we're waiting for individuals to respond, first, I really want to thank all of you for joining us today. As mentioned, public health is evolving at really, really rapid responses. As Claire mentioned, we were dealing with COVID, and now, we're dealing with issues related to measles. And there's so many issues where public health is influencing everything, effect of climate on health, opioids, sexually transmitted infections, interactions between healthcare and public health. It really, really is broad. So I really appreciate all of you joining us. Hope you learned things today. And I really want to thank Claire, for sharing your wisdom with us. I mean, with the Information Futures Laboratory, the reason it's been created is because it's such a dynamic system that we're dealing with, and we all have to put our best minds in terms of addressing this. So, and then also, Fran, I want to thank you and the School of Professional Studies for hosting us. So, stay tuned. Again, I really want to thank everybody for joining us today. We all have a common mission, that is keeping those of us under our watchful eyes safe and healthy. And I want to thank all of you for doing everything that you're doing for keeping everybody that we interact with safe and healthy as well. So, Fran, let me turn it over to you for any closing comments or thoughts that you have as far as next steps.
Yeah, what a wonderful talk. Thank you, Claire, so much for your time today and for imparting such a wisdom. We will be, and Scott as well, for organizing and facilitating the discussion today. We will, the talk was recorded, and we will be posting the recording on our website. So look for an email from us in the next few days for when that recording becomes available. So with that, any closing words from you, Claire?
No, just thank you. I know how busy everybody is, but to Scott's point, just trying to keep up with this, it's a real example of the need for lifelong learning. So I appreciate everybody being here.
All right.
Wonderful. And with that, I think we can wrap up a few minutes early and give everyone a few moments back in their day.
All right.
Thank
Thank
you.
you. Have a great weekend, everybody.
Yes.
Thank you.
Bye now.